reminded us we have a tight timetable, and I've been given the job of being a policeman for this session. All I am. This session is about systems-based impact evaluation. Ask the question why is really setting the scene in somewhat overarching terms, whereas the next session around complex systems and evaluation is more a grounded, practical, case-based thing, although everybody's work is obviously rooted in experience and cases. Each speaker will speak for about 20 minutes, or about 20 minutes, for exactly 20 minutes, not longer. We have 40 minutes, and the discussion is going to take place in groups rather than in an open session, although there will be some open session feedback afterwards for us to be able to share things that come up in the groups. So I'd like to invite Bruno Marchal from the Institute of Tropical Medicine in Antwerp to talk about conceptual distinctions, complexity in systems, making sense of the evaluation of complex programs. Bruno.
Thank you, Elliot. So as you can guess, I'm not from the development world. I'm a bit of the black swan in this meeting, I think. But a lot of the things I'll be discussing in the next 20 minutes are quite similar to what have been discussed previously, and it will resonate with a lot of you, I think, because I think basically a lot of the problems we're facing in health and in research in health are quite common with the problems of development. Now, what I will do in the next 20 minutes is take you on a journey that kind of summarizes our Odyssey. I think we've been talking about war, and the war is perhaps not over, but let's say that the war is lingering on, and we're leaving Troy. We went on an Odyssey looking for answers to some particular questions. And the key question in our department is, what is performance of health systems? And our line of research within that broader agenda was, how can you assess the impact of management on performance of healthcare organizations? And then basically, you follow the traditional way of doing evaluations. You look at outcomes, and if that's too difficult to assess, then you look at the proxy indicators, in our case, service provision. But of course, there is an interaction with the environment to take care of, and there's of course the whole issue of values and organizational culture. And so the framework we kind of found at some stage is the framework that was developed by C. Cott and colleagues. That's a Canadian team of researchers. They looked at the literature and tried to see what the frameworks are for performance analysis. And the most comprehensive one is the one they developed themselves. So we kind of adapted it and we used it to figure out how medical practices can affect performance of hospitals. And a lot of the research took place in Ghana at district and regional hospital level. So answering this kind of performance analysis questions forces us to figure out how to do that. And we followed kind of three streams somehow in parallel. And I'll take you briefly to the systems theories, very shortly then into some sense-making frameworks, and then end up with the kind of methodological approach we found to be quite useful in this work. But before I start, I think the name of Ray Paulson is going to fall quite often in these meetings here. I think it makes still a lot of sense. I mean, that is that programs are about people. And in my world, in the world of public health, where health and medicine, and therefore more positivist approaches are quite dominant still, this is an important thing to mention. I think it's fairly as a problem here, or an issue here, but back in the other worlds, I think people tend to forget that programs are not magic bullets, but it's about people doing things. And I'll make the circle around when I come back at the end to redistribution. So, an overview of systems in 2 minutes. A lot of this will be just common sense to you, and I'm not going to spend too much time on that. I think there have been excellent papers written on this, far more in the development world, by, for instance, Ben Ramalinga, with brilliant work, I think, in writing 2 papers on compiling and analyzing the usefulness of systems thinking and complex systems thinking in development. There's this definition by Morin, a French philosopher. It's about, quite simply, saying that systems are groups of people linked to each other. It's about structures and processes. That doesn't say so much, of course. But then, of course, there have been a lot of other schools in systems thinking. The mechanical perspective is out. We, I think, kind of done that in the 1930s. But needless to say, it influenced a lot of management thinking in the 1920s. Taylor, Ford, these were approaches used at that stage. Let's dig a bit into the open systems and the complex systems approaches. Healthcare organizations are, of course, obviously open systems. If you look at hospitals, they just display all these characteristics. You can kind of put a boundary around the hospital, but the boundaries are open because hospitals need resources, of course. If they are not supplied with resources, things die out. That's a resource dependency issue. And you need to understand their embeddedness in the context also of other organizations. So not much of a problem here, I think. That's quite common sense. And it influenced a lot of systems thinking in the 1990s. Complex systems adds a few layers of complexity, of course. And again, I don't think you have much trouble to see that any kind of an organization, basically human organizations, are complex organizations. It's about these interconnections and especially the non-linearity of the relationships and the cause-effect relationships that as a consequence are disproportional or can be non-proportional, that causes a lot of the unpredictabilities of complex systems. We've talked about, but previously about feedback systems which make that things can change in small incremental steps but lead to completely different patterns of behavior of organizations. The past is important and it's not. Path dependency, Bob talked about it just this morning. I think the useful thing to remember out of that is that the unpredictability of systems and organizations is not limitless. Take an example of the national health insurance system in UK. That's not going to shift in 2 weeks or even 3 years to the continental kind of Bismarckian models. There's a whole history that led to the situation of national health service right now, and any kind of government will find it extremely hard, I think, to shift it on its grounds to another thing. So path dependency is quite important. It kind of puts a limit on what's possible and how organizations actually can evolve, which is already helpful. But it's also about adaptive systems, and then we enter into the jargon of complex adaptive systems. Adaptation is a basic capacity, I think, of human beings, and it's the human beings in organizations that make them to be adaptive. Now, adaptivity is not just a passive adaptive to the environment, because of course there have been management schools looking at that, the contingency schools figured ways out of looking at the environment and co-evolving with demands from the environment. This is about learning and human adaptation, it's about flexibility and making sure that the organization thrives and innovates. So the terms of emergence and emergent behavior is at its place here. Now, this gives us quite some problems, of course, and there are quite some consequences here. If you look at it from the point of evaluation, and I'm much more perhaps from the point of research, but it has the same challenges. One of the conclusions of this kind of literature is that complex systems can only be understood as a whole. That means the elements and the interconnections between the elements, and then the way the whole thing moves. Not forgetting the importance of history. You cannot fully predict the behavior of systems, even in fact, if to some extent they're boundable. There is this element of non-linearity and of emergence, which is difficult to capture. And so I don't think I need to say that it's useful to have this kind of insight, but the literature on complexity doesn't show us much on how to deal with it. It's useful to describe things. It's quite easy to see something in it, but to find good examples and kind of consequences for research, that kind of answers is not found in the literature on theory, and on systems theory or on complexity. So, okay, digging into that literature, we found out that in fact a lot of those things have been written in public health in the 1990s, around 2000, but then it kind of died out. And I think the conceptual confusion in one hand, but also the limited practical applicability on the other hand, may explain that this kind of stuff is not really taken up in the public health discourse for the moment. Now, there are other ways to deal with complexity, and if you then go into another kind of literature, you find the sense-making frameworks. And this is work done basically by Stacy, but also by the team around Kurtz and Snowden and Bruno. And what these people do is not start from the definition of complexity on the basis of complexity theory, but rather from the point that, well, there is a reality out there, and sometimes you can make sense of it, and sometimes you can't. Sometimes there are rules that explain things, and sometimes it's about heuristics. Sometimes it's about order, and sometimes it's about unorder. And I'll not explain most of them here, but focus on the Cunifin framework.
So the Conifing framework was developed by Kurtz and Snowden. They did quite some research on this. They come from the knowledge management field. They did work for the military, DARPA, and I'll actually cut some corners. I mean, the whole presentation is about cutting corners, so I'll excuse for the shallowness of the presentation. But I think what's important here is that to say that what they do with the framework is make a difference between simple, complicated, complex context. We'll not discuss the chaotic ones at this stage. The simple context is the situations where you find that cause and effect relations are simple, they're clear, you can understand them, they're linear. And as a result, actually, you have predictive models. So managers know what to do. It's no fuss management, it's about command and control. An example from health, if you want to control the cholera epidemic, it's a matter of finding the source of contamination, it's a matter of finding the patients, treat them, and we know what to do. There's no innovation needed here. We don't need so much of expert at this stage here. Which also means, in fact, its consequences for evaluation, in the sense that assessing impact is quite straightforward. And we have statistical and other methods to do that. We need just right skills to assess the linear relationships of cause and effect. On the other hand, complicated situations are situations where in fact the problem is constituted by a set of simple problems and where the cause and effect relationships are known, but perhaps they're difficult to know. Not everybody knows them at first sight. So that's where the field of the known unknowns comes in, and where effective management requires expertise. And expertise basically is past experience. It's knowing from the past what works. It's able to being able to recognize the patterns and then to just kind of institute the right management approach. Construction of railroads across China is not a complex issue, basically. It's about complicated knowledge, it's about complicated problems, and now and then, of course, we'll go into the complex field. But this is about mobilizing the right people with the right experience and setting up a complex, a complicated program to manage the whole thing. Which has consequences for evaluation, of course, as well, in the sense that with the right background and expertise and the right toolkit, you can make sense of complicated problems. And what you need is expert evaluators, people who have the experience, who can kind of step back at some stage, know what's happening, then use the right approach to evaluate the thing at hand. Now, when you find yourself in situations where there are some patterns of cause and effect, but where we don't really know them, and where the relationships are nonlinear and therefore unpredictable, then in fact we are in the unordered domain, that's what they call it, the domain of the unknowns. And if you think about unknown unknowns, that's actually a major problem for evaluators and for research, because actually we don't know what we don't know. So how can you predict and how can you evaluate something that you don't even know? How can you capture that? How can you monitor things that you don't know may be important? As a consequence, the notion here, and I think the keyword here, is the retrospective coherence. You can only make sense of things after the fact, after having seen what happened, and you can try to make sense of what happened, not during, not before. Which also means that expert knowledge is extremely limited in use. If you have this narrow definition of expertise as knowledge and experience, let's say knowledge based on experience and on past experience, which means knowledge that you can construct on the basis of the known things, then expertise in the domain of the unknown unknowns is almost useless. So what do managers do in that kind of situation? It's about pattern matching and basically fail-safe experiments. They try things, they just delegate the decision-making things, domains and fields to the people who are working and kind of confronted with the problem. You make sure that they get the right kind of information. You set out the protocols, but you let them bricole. It's what you said this morning. You let them try and error and make errors to make sure that they can actually fail without too many problems. So it's about letting 1,000 blooms flower, and you see what kind of thing comes out, and you test and you use the right one, the one that proves to be efficient. Once you know what's happening and you understand it, then we're back into the complicated field, of course. So it's continuously moving from complex to complicated, and sometimes from the complicated to the simple field. But of course, the questions for evaluators and researchers are like in this thing, that is that we face here unknown things, which means that we need adaptability, flexibility. We need designs that adopt multiple perspectives, not only from the researcher's point of view, but also involving stakeholders, because these are people who can give us explanations, these are people dealing with problems. And, well, I'm not sure if that's shocking for you. It's not so shocking for me, but it was our second line of attack to convince our more positivist colleagues to say, look, if the complexity theories doesn't tell you much and you say it's all complex and I don't understand it, fine, let's try it this way. Acknowledge that in some cases we won't be able to know what's happening, so you need to deal with it in a flexible way. But it doesn't work for a lot of the people now. I mean, I'm not sure how it worked out with our colleagues. At least for us, it kind of enlightened our field. So the challenges are about accepting uncertainty. And that's a mentality change. It's an attitude change. It's
yeah. You have a 4 to 5 minute warning.
yeah. Sorry, but I'll talk a bit faster.
Barbara, usurping my role.
Okay, sorry.
Well, I think that's a nice way of human adaptability actually, and redundancy of systems to make sure that my performance will be controlled. I think the last one will be to pull out the power cord of my computer. So there are actually things that you can use to be reflexive. I won't go into the details here, but there's a lot of things known on that field actually. The second major problem is about emergence. How do you capture the unforeseen and the unplannable and the unknown things? And again here, not in the field of public health, but in a lot of other domains, there's plenty of experience. Causal attribution, we had a discussion already this morning. I won't repeat too much of that. The key thing here is to find the mechanisms of change and try to come to plausible explanations. And so there are methods which have been developed in the last 10 years, which again are crossing over to public health very slowly. And then the last one, and the key question, and then I'll come to the end of my Odyssea, is about the whole issue about social complexity. At this stage, I think in public health there's a lot of attention for modeling approaches, a lot of statistical and mathematical complexity which is being tackled. There's agent-based modeling, there's the system dynamics modeling, plenty of people are going into that direction. But the point is perhaps here that we may need more attention to the social complexity rather than the mathematical complexity. Because if you kind of accept that not programs change things, but people change things, it's about understanding the people, of course. So developmental evaluation was mentioned this morning. And emergent evaluation design, I think the whole book is a very nice argument, in fact, for the kind of things that come out of the complexity analysis and the sense-making frameworks. And then there are, of course, the theory-driven approaches. Now, what I'll do here is just talk a bit about realist evaluation. That's the kind of the avenue we've taken in the last, 8 to 10 years in Antwerp. And we feel it particularly powerful because of its philosophical roots. It's far less pragmatic than theory-driven evaluation or theories of change. Now, we may not agree on the critical evaluation or the critical realism part of it, and you may have read Ray Clausen's latest book where he kind of qualifies his relationship with critical realism. Let's say 2 things to focus on here is that the notion of generative causality is something which is very useful. If we know now that we can only get to plausible explanations in complex situations, and that mechanisms are perhaps more important than kind of demonstrating impact, which in complex situations is not possible, I think, then the realist evaluation approach offers quite some seductive way, in the sense that it's about the causal mechanisms that are residing in the social relationships. And interventions basically trigger changes in people's minds. The changes occur between the ears and in groups of people. And programs are basically opportunities or possibilities that you give to people, and they will do it or they won't. They will contribute to the program's objective or they won't. Now, the triggering of the mechanisms which are psychological, social, or organizational, or institutional, or cultural, that happens only in particular contexts. And so the whole thing about realist evaluation is figuring out what is the hypothesis you start with, and they will call it a middle range theory. It's called also program theory. It's basically the explanation of what makes that the program induces a change in the thinking or the behavior of people that at the end contributes to reaching the goals of the program or not. and figuring out how that kind of mechanism is triggered in a specific context and not in others. So if you have an hypothesis that is able to explain that, then I think you have a good starting point for a realist evaluation. And so it's about cycling through these things. You start with a theory, it's a hypothesis, it can be a very simple one. You go through the cycles of your design of the study, analysis, synthesis, you refine it, you adapt your starting point, you retest it in different contexts, in a number of cases, up to the point where usually the money runs out, and you end up with conclusions that you are going to provide to your commissioner or the people who fund your research. The advantage of this thing is that the middle range theory is actually a bridge not only between cases, but also between the existing knowledge and your empirical facts and data. And it allows you to cycle through theory, conceptualization on one side, and practice on the other side. And the theory, I think we should put some kind of question marks around it. It's about plausible findings. And the realists are quite cautious in claiming the universal validity of their findings. It's about specifying what works in which conditions for whom, which seems to be a logical answer to policymakers. But I'm not sure if I share the optimism of this morning. I mean, Bob, when he started, was saying that policymakers want that kind of information. I think I'm doubting about that. Anyway, that's perhaps for discussion later. So to conclude, I think our odyssey through the landscape of complexity and methodology kind of led us to the Conifin framework that is useful to some extent. The complexity jargon is useful to another extent, but it's not sufficient. The modeling approaches, I think, can be quite useful, but we need to pay much more attention to the social complexity of issues. And to do that, I think, well, one of the avenues is the theory-driven approach. There are plenty of other ways of doing things. There was a whole list I mentioned this morning. I think if you take the realist approach to its kind of fundamental starting point, then it's perhaps even an overarching meta-framework that explains all. You don't have to do that. I think even taking the realist approach in a more simple and superficial way can be quite helpful in enlightening. So thank you for your attention, and I'll be happy to answer questions after that.
We will have questions later.
I do work at the Gates Foundation. Right now I'm based within the enterics and pneumonia team working on child health pathogen programs, so looking at childhood, anything that causes under 5 mortality of children. But I'm also very engaged within our evaluation community within the foundation to try to bring more and more systems thinking into that process, and started a learning group last year with just a few program officers, and we've been able to grow that learning group to across the staff, including communications and advocacy and other folks. And so while the work I'm going to talk about is actually based on some dissertation work I did while working with the CDC in Zambia, so it's basically a research journey from 2006 to 2012. I am using these approaches at the foundation as well, and we're gaining a lot more interest among the program officers on how to apply these in very practical ways. So as I said, this demonstrates a chance that I had to actually use a systems-based approach within a setting to do a strategic evaluation, and then to study that as an innovation as a researcher, but also as the evaluator who was commissioning a system dynamics model. And so that led to a lot of learning in the process, as you can imagine. So what I'll talk about today is I'll try to define what I call systems-based evaluation. Also talk about the research objectives that I took, some key features on the utility of systems-based evaluation, which is really the core of what I'm talking about today. What is the framework for utility of these approaches, and what does that mean for our practice as evaluators and evaluation managers? I'll talk briefly about the case study in Zambia. I'll then talk about the highlights of the research and what the implications and recommendations were for practice. As we've already talked about even this morning, are we tackling complexity with old methods, or are we trying to tackle complexity with new approaches that are emerging from evaluation? And I had to put some guardrails around that very fast in my research. And one of the things I would propose is that systems-based evaluation really is the application of specific kinds of methods that are influenced by systems concepts and methodologies to the task of evaluation. These are methods that actually drive us to look at those interconnections rather than just recognize them, but really to get to the heart of those interrelationships, interdependencies, and real-life factors. That, to me, is the difference between the different sets of methods. So I was in this opportune situation in Zambia between 2006 and 2008, 2009, where the antiretroviral therapy for HIV treatment was scaling up in Zambia. I was working with the coordinator of that program at the Ministry of Health, and he very much wanted to get a sense of what was going to be the impact of a very targeted, target-oriented scale-up approach on the health system. So at the same time, we decided to move that process ahead, and also to then, as I said, study the utility of that and to try to identify some useful principles for the field. I have a certain philosophical stance that I took, which was rooted in interpretive approaches to anthropology, and specifically the critical hermeneutic tradition, which brings together thoughts from Gadamer, Habermas, and Ricoeur, and different frameworks around social action, language, and theory, which proved very helpful as we rolled out the evaluation as an innovation. This allowed an interpretive framework to look at that research process. I looked across the different features in the literature of a number of different approaches. A couple of them my colleague just presented now. And I have to come back to what Bob Williams and Richard Himmelbrunner have already written about, and also a little bit what Gerald Midgley has said, and that when we get to the end of the day, a lot of these approaches, the uniqueness about them is that they're exploring interrelationships, they're trying to engage a multitude of perspectives, and they're looking at a multitude of boundaries. And in fact, it's a function of these are required in order to get to a systems orientation. One of the tensions I found in the work was that there are two ways to look at this kind of work. One, we can go around drawing pictures and try to represent what we think the system is, or we can actually see ourselves as part of that system and trying to transform it. So I tried to put it into a simple phrase. One is, now that I understand that the problem is a system, I can see or consider and evaluate what's needed to possibly change it. I may be the one to change that, or I can help advocate for someone else to do so. And that is a practical utility of a lot of these approaches. Another utility is that I was part of describing the problem in the system. I am part of that system. I care about the system, and I value certain factors and connections. I will now go and create and be part of the new system. A pretty tough remit for most evaluators, but it is largely the role that we're more and more being put into, I think, as we engage with partners. So the research I did gave rise to some of these concepts, and then I was able to take that framework and go back through the research and see if it was true. And we sort of fall in this sort of hole of, as evaluators managing, are we trying to orient this process towards a transformative effort, or are we merely trying to use some systems tools and drawings to represent the system and to increase understanding? There's value in doing both, and what I found in my research is that doing the representation part is the easy part. Getting people to use the findings, getting people to engage to the degree that you need them to engage to actually transform the system you're trying to transform is really hard and difficult. And we actually did not succeed on that front. So we're constantly mediating between these modes of, are we trying to get a representative view, or are we really trying to do transformative work? And what rose out of the research I did with a number of stakeholders that were involved in this SD project some core things popped out which served as a sort of a spectrum of utility for these approaches. Can we align pre-understandings among the participants and stakeholders? Are we able to use the approach to develop a shared comprehension of the dynamic situation and its components? Are we able to provide some space to argue the validity of these things and different perspectives, particularly around the interrelationships? And are we able to move to action? A lot of our engagements are somewhere along the spectrum as evaluators. So the case study is, as I said, it was a unique opportunity to get involved in the expansion of HIV/AIDS services in a very target-oriented environment with Global Fund funding and the U.S. government funding. And the complexity of the ART plan, so they had a scale-up plan for 2006 to 2008, really called upon some key questions about the capacity of the system to deal with such an expansion of services. So I did some pre-work with key stakeholders around what if we tried something different. And so I asked a few questions around, can you explain some of the different interconnections in this system that we're dealing with? And they were able to do that without any problem, and I think most people are. And in fact, I had one of my African colleagues tell me, it's actually the Western things that people bring in that we can't understand. I think in systems all the time. I think in my family system, my community system, my societal system. So of course I can think in systems. So there was a real openness and a real eagerness to move beyond the sort of target-oriented M&E approach that was currently in place. This is just a quote from one of our partners, and you can read it in the handouts, but basically saying that, hey, we've got the medical part down. I know when to give this person the therapy that they need. What I'm concerned about as a practitioner is the wider system of support that these folks need to survive. So I was able to test some of these utility aspects. That's on the next slide. I won't go into all of this, but basically people are able to think in dynamic ways pretty fast and easily. They're able to consider those situations pretty readily. They can offer data and different validations of what they're saying. They can offer reinterpretations. And they can also offer, because of their concern about the context in which they're acting, they're able to suggest notions for action. So that was the pre-work. Then for the case study, we had to submit a proper protocol to my agency and get all of that organized. And so we pulled that together. And that's a whole different discussion, maybe over a beer. But the idea was to really assess the typical point at which the patient load, the sheer volume of people coming to the clinic, would outstrip the system. And we wanted to see, what if we played around with the roles and numbers of different kinds of supportive workers and played around with their tasks, what that would look like in terms of that impact. And then to look at the success and participation in those supportive services and how long we could sustain the RT. And Barbara, when I sent the presentation, she asked me, can you talk a little bit about how is this impact evaluation? And I actually thought, wow, no one has actually asked me that. And in fact, I think it's a virtual impact, kind of a virtual engagement in what might be the impact. Because what we were able to do with the model, and again, this is maybe a side discussion, but this is kind of the classic system dynamics overview model, which was given the name by one of my participants as the spaghetti picture, which has been adopted by some other folks. And it essentially shows a stock and flow of people moving through uninfected into infected. There are a number of levers that influence this biologically, but also then down towards the bottom, what we were trying to get at was what were the core supportive service cadres that would be critical and what would their tasks be to change the impact on the system. But because it was a broad system dynamic model, we were able to actually produce and show reductions in infection rates and also reductions in viral load. Now, as my colleague just mentioned, there's a lot of gravitation towards these sort of hard number kind of modeling approaches in public health. I gravitated towards it because I could find someone to do it, and it was going to work with my stakeholders being medical epidemiologists. But there are many other systems approaches, as you know. The point of this slide really is to just show one of the outputs of the model, to show that basically the supportive service cadres were doing their job so well that they were recruiting people and encouraging adherence, that everybody was coming back to the clinic to get lab services and to get their drugs. Until we could actually outsource that, this huge green bulge there is what you're looking at over time, the sheer volume of people that will be constantly coming back to a clinical setting to get certain things. And that was kind of what we thought, but the extent to which the role these other supportive services played in that was not so intuitive. So the conclusions of the evaluation itself really were that really they would need additional clinical staff. I think we found in the model outputs it was 3- or 4-fold increase in clinical staff to meet this demand over the horizon. And then unless certain supportive service workers could perform different kinds of tasks, they wouldn't be able to achieve the goals.
4 minutes.
So after that, I went around and interviewed the stakeholders again. What did you think? It's important to note that my role in this was not the modeler, but really as the shuttle evaluation diplomats. The modeler was in the US, we had a number of conference calls, but it was not a group model building experience. And that is where the break between making a representation and having a transformative process is very sticky. But the good news is that just using that representation alone triggered lots of new and different thinking among the stakeholders. It stimulated reinterpretation of key relationships and new possible boundaries for the system. We had medical people starting to think about psychosocial care and food services where they hadn't necessarily thought about that. The stakeholders had a lot of comfort with understanding the model's structure, and they felt they trusted us to do a good job, but they weren't quite convinced with the model outputs, which I think was fair, and I think that also indicates the spectrum between the engagement of the representation phase and the transformative action. I won't go through these, a lot of what I just said. But the participants really asked, in the end, for more time and opportunity to understand the modeling and analysis. They really wanted to know, what are these differential equations, what they look like, how do we make them, can I make one, can I have a model on my computer and run my own simulations, which are all the kinds of things that people should be asking. We really learned that we needed to collect a broad variety of perspectives at the very outset of the modeling process. We learned that systems-based evaluation demands the planner evaluator to emphasize some kind of aim. Are we aiming towards a representation? Are we aiming towards a full-scale transformation of how we think and how we act in the system? And that determining the system's boundaries is really a methodological requirement or asset of a systems-based evaluation process. And it can be facilitated with an aim to move stakeholders to action. But sometimes things do fall apart. So in my case, I actually moved from Zambia to Tanzania to take another role. But that was also at the same time Zambia fell into quite a scandal with the Ministry of Finance over the health funds that were coming in through the Basket and the Global Fund. So I wasn't able to go back and continue the engagement process that we had started with the Ministry of Health, which is too bad. But I still had a dissertation finder, so that was good. In the table here, I'm just talking again about the role of the evaluator here. We're mediating these two roles of, is the process aimed to be representative? Is the process aimed to be transformative? There are a number of situational needs. There's an ontological role that we play there. There's an epistemological role. There's a boundary critique that needs to be done. Design factors and the strengths and limits of certain methods, and the capacities required for implementation. If you're doing transformative, there's one set of things that we need to be managing for as evaluation managers. If we're doing representative, there's this interrelated but somewhat separate set of things that we need to be doing as managers. So I'm happy to take questions on that if you want to look at some of that text. I want to keep on time. Just some acknowledgments. Patricia Rogers was my dissertation supervisor, so I learned a lot from working with her, and Bob Williams, of course, doing early work on this. And many other people in the field. So just want to thank you again for the opportunity.
I'm assuming that we're going to go into groups now rather than start a discussion that we may not be able to finish more than a minute of. The aim is that in the groups at different tables, which have been carefully chosen, as you know, by Barbara, we will be able to discuss some of the underlying issues, bearing in mind all the time some of the